And what I mean by sign-based approach is the approach that with a number of other gait experts led by Dr. Bastian Bloem from the Netherlands put together a while ago. We decided to propose a simplified approach to gait disorders diagnosis, because the classic approach based on textbooks is not always practical, and it's also quite complicated to use in clinical practice. What happens often is that the patient comes with one major complaint about their gait, and it's not necessarily the whole spectrum of what's been reported in the literature and what's written in textbooks. Or sometimes, yes, there is a major complaint and additional signs associated to it, but really the clinician should focus on the major aspect, the major feature of the gait disorders presented by this patient. And from that, we created a number of checklists, a number of lists of many conditions that can cause that particular feature. So this narrows down the possible options. And from that, you can get closer and closer to the final diagnosis. So, for instance, cerebellar gait in textbooks is written, it's weight-based. The patient might have a dysmetria of the lower limbs and other associated cerebellar problems like dysarthria, oculomotor dysfunction. But you might simply have a patient in your clinic with just weight-based and not presenting the rest of the features. Yes, weight-based gait is typical of cerebellar disorders, but it's also typical of other problems, including orthopedic issues. So if the clinician focuses on the main sign, in this case, weight-based, and follow the guidelines and the checklist that we provided in our approach, little by little, as I said, this clinician will get closer and closer to the final diagnosis, which is not always that easy for the many reasons that I already explained.